Hello, today we'll be doing a prone CT adjustment. Before we do the adjustment, we should do a joint plate assessment. To do so, patient is seated, facing away. I'll be behind the patient. I'll be placing my hands on your shoulder if that's okay.
Yep.
I'm going to rotate the patient away. I'll be using my thumb, placing it on the transverse process of T1, T2, and T3. Same thing on the other side. Rotate the patient away. Transverse process of T1, T2, and T3. Good. And then to move on to the adjustment, the patient will be laying face down, so go ahead and lay face down. So patient position is prone. Doctor positions me on the side of the patient. I tend to do a fencer stance. And then I'm going to ask the patient to rotate their head away from me, so go ahead and look to your left, please. Good. And I'm just going to move your shirt down a little bit here if that's okay.
Yep.
So my contact hand is going to be the closest to the patient's body. I'll be using my piezoform onto the transverse process. What I'll be doing is going to do some tissue slack from medial to lateral from the spinous process over to T2 transverse process. And then my indifferent hand or my supporting hand is going to reinforce at my wrist here, making sure my body is lined up and over the contact so I can do a body drop. And the line of drive is going to be P to A. So my final pose will be here. Tissue slack over, and boom.